It's 6:11, so we'll get started. Did everyone have a nice break? It was very short. But hopefully everyone had a nice time off and didn't think about school for a little bit. I'm super excited. I see lots of very familiar faces in here. So this will be a fun quarter. It's a very large class. This classroom is a little odd in the setup. I'm gonna have to I don't know. You're all very far away, but I can't do anything about that. All right, well, welcome to Media and Technology and Health Promotion. It's going to be a good quarter. I've taught this class since I joined Cal Poly starting last year. I taught the lab for the first time last quarter, and I think overall it went well. So I'll be making lots of improvements to the lab portion of the class based on the feedback that I got from students last quarter. But today we are going to just kind of be going through an introduction. If I can get this to advance, there we go. So our agenda for today is to kind of talk about the course, talk about the importance of this course. We'll talk about the syllabus and kind of the expectations of what you'll need to do this quarter. And then we're going to have a very brief introduction lecture where we're going to talk about kind of the introduction to technology-based health promotion. And we'll talk about kind of what is health promotion in general. And we'll talk about some different uses of technology in health promotion. We'll talk about some benefits and challenges as well. So this course, how many of you have had epidemiology with me? That course is a lot of work, right? Could be really stressful. This should not be your most stressful course you're taking this quarter, okay? I'm just gonna say that right now. I want this to be a fun course. You're gonna be doing lots of fun things in your lab. You're gonna create a website with your team. You're going to create a podcast. We've got lots of kind of fun things that we're gonna be doing. So I hope this course is enjoyable. And you've got readings, you've got asynchronous material that you'll need to complete, but it's pretty straightforward in terms of the expectations. So I hope that this class is not like super stressful. You know what you need to get done every week and you get it done every week. I'll talk about the class a little bit more, but there's no final exam for this class. So you don't have like a big exam looming over you. And there's no midterm in this class either. You've got weekly quizzes and discussions, which we'll talk about. But again, hopefully this class feels very manageable. Did you say you wanted a midterm?
No. I'm crying tears of joy.
All right, good. Okay. All right, so these are your learning outcomes for the course. These are listed in your syllabus as well. So I'm sorry, these are this week's learning outcomes, not your course learning outcomes. We should go over those in a few slides. But this week, I want you to be able to understand the course policies, the structure and important due dates, identify types of technology used in health promotion. Your first asynchronous material that you'll complete goes over different types of technology, which you'll see on Canvas. Describe different types of technology and their use in health promotion, and describe the benefits of using technology in health promotion and also the challenges. There's some benefits as well as challenges in terms of technology. So before we get into the actual course, I just briefly wanted to introduce myself and talk a little bit about the use of technology in my own career. So for those of you who don't know me, I'm Adrienne Lent. You can call me Dr. Lent, Professor Lent. You can call me Adrienne too. I'm totally fine with that. I grew up in Los Angeles. I'm from California. I got my undergraduate degree in biology from UC Santa Cruz. Thought I wanted to go to med school and then very quickly realized I did not want to do that. I then got my master's of public health and my MBA from the Claremont colleges in Southern California. And then I got my doctor of public health degree from the University of Arizona. My degree is in public health policy and management. So a lot of my research is really focused on health policy, access to care issues, primarily around cancer prevention and control. A lot of my career, I've worked at a cancer center. And so a lot of my research has been cancer focused. All right. So How many of you plan on pursuing a career that is focused on media and technology? That's what I thought. Okay, so you might be wondering, why the heck am I taking this class? Is anyone wondering that? Yeah. So what I will say is that technology is present in pretty much all public health and clinical health settings, right? You can't escape technology today. It's always around us. And so I want to talk a little bit about my experiences with technology and health promotion, because everywhere I've gone throughout my career, I have had to deal with technology in some sort of fashion and in different ways. It has posed challenges to different things, but it's also been really beneficial. So when I finished my master's degrees, I went to work for a large Medicaid and Medicare health plan in Southern California. And I had kind of two areas I worked in the health plan. One of them was in their pharmacy department, looking at pharmacy claims data and electronic medical record type data. When I went on to the University of Arizona Cancer Center, where I started doing more research focused work, I've done a lot with online subject recruitment for research. So recruiting people for studies online. I've helped support other investigators recruit subjects for online research. And I also ran a community-based health promotion program. It was a program that recruited people across Southern Arizona to meet up for walking and running groups. And they raised money and awareness for cancer research at the Cancer Center. And all of that was done on social media. And I coordinated all of that through social media. And so that was really effective in getting people to engage in the program. And then another important kind of stop along the way in my career was working for the Arizona Smokers Helpline, or the ASH line, which I'm going to talk about in a little bit. But that was a very heavy technology-focused, technology-based program that helped people quit smoking. It's a tobacco cessation program. Okay, so I want to talk about Ashline a little bit because there was a lot of different technology that was used in this program. How many of you have heard of a quit line? Okay, so some of you do. All right. So we're going to watch a brief video on what is a quit line. So if you don't know what a quit line is, you are going to know by the end of today. Hopefully we have sound.
And referral to a quit line can help your patients quit smoking. Do you have patients who smoke? In addition to the cessation counseling you provide, referring your patients to a quit line can also help them quit smoking. Here's what happens when someone calls a quit line.
Hi, I've been thinking about quitting smoking, but I'm not sure where to begin.
It's great that you're thinking about quitting. It can be hard to quit, but the quit line is here to help you succeed.
Most people who smoke want to quit and have tried to quit several times before, but many aren't aware that calling a quit line increases the likelihood of quitting. Quit lines provide free and confidential coaching to help people who smoke become and stay smoke-free.
I've tried to quit smoking a bunch of times on my own, but haven't been able to stop for good. So now I'm ready to try something different.
Well, for lots of people, calling a quit line is what they need. When you're ready, I can help you build a plan for quitting, talk to you about medications that might help, and tell you about free tools and resources you can use to quit smoking.
When someone first calls, they'll be asked a few questions, such as how much they smoke and if they've tried to quit before, so the quit coach can make sure each caller gets the help they need. Then they'll talk about putting together a personal quit plan, including setting a quit date.
How much does all of this cost?
Quitline services are free for callers, and we have lots of resources to help you.
Sure, but I'd like to know, is what we talk about private? Do you share any of what I say with my insurance or my job?
Everything we discuss is completely confidential. An exception would be if you mentioned an emergency or crisis that was a clear danger to you or someone else.
Quit coaches can help callers understand tobacco dependence, nicotine withdrawal, cravings, and triggers. They can also help callers learn ways to cope with difficult situations and let them know about resources that can help them quit. These include texting programs, websites, and mobile apps. Quit coaches can provide callers with information on cessation medications and how to correctly use them, including nicotine patches, gum, and lozenges. Coaches may also encourage callers to talk to their healthcare providers about medications. In some states, callers may be able to get a starter kit of cessation medications like the nicotine patch or gum from the Quit line.
Just knowing that others have used these techniques to quit smoking really helped me. It told me these things actually work.
What's great about the Quit line is that they help you prepare to tackle tough days when you may feel like you just can't do it anymore. When I needed extra help, they were there for me.
Combined with your ongoing support, referring your patients to a Quit line may be just what they need to quit smoking for good.
Okay. So now all of you know what a Quit line is. It's a telephone-based tobacco cessation program that helps tobacco users quit. So a lot of my students say, well, no one smokes anymore, but that's simply not true. There's millions and millions of Americans who still smoke. And when you think about who still smokes, it tends to be individuals from lower socioeconomic status. When you look at that by health insurance type, individuals with Medicaid smoke at double the rates of those with private insurance. And so this is really a public health issue that affects some of the most vulnerable people in our country. But every state has a state quit line that is run in each state. 70% of smokers want to quit smoking, but nicotine is one of the most addictive substances in the entire world. And so quitting smoking is really, really difficult. And so every state has a tobacco quit line that their resident can call that quit line, get usually free services through that quit line. There's text messaging that's involved. You usually get assigned to a quit coach. So you work one-on-one with someone who might respond to those text messages. There might be automated responses that go back and forth with the text messages. But really the evidence-based, most effective treatment to help people quit smoking is combining behavioral counseling along with pharmacotherapy. So things like the patch and the gum and the lozenge, nicotine replacement therapies, combined with behavioral counseling is going to be the most effective and evidence-based way to help someone quit smoking. So state quit lines leverage a lot of different types of technology to try and deliver those services effectively to different populations. It's also really important that state quit lines are integrating technology into their services because e-cigarettes are also a really big issue now, right? And when you think about who's using e-cigarettes, it tends to be individuals who are younger, right? It's kind of a younger population that we're seeing now using e-cigarettes. So that technology piece is really important. Okay, so to get people to call the quit line, the state of Arizona, where I worked, the state of Arizona would launch these media campaigns via all kinds of social media. They'd create these YouTube videos and they would blast them out. They'd show up on commercials when you're watching TV. They'd show up on Facebook, on Instagram, all these social media platforms. So I'm going to play you two videos. The first one was their kind of original campaign that they had going for a number of years. And then they switched it up a little bit. So we're going to start with the first one, and then we'll talk about the second one.
How much longer will you wait? How much longer will you go through the motions? How much longer will it be before you pick up the phone and call the Ash line? Double your chances of successfully quitting. Call me while you still can. 800-55-6622.
All right, so a little eerie, right? Or like reclining back into death, basically. So very like kind of negative, scary message that they're sending out. Okay, so let's take a look at the second video. Little context before I play this one. So those videos have been going on for quite some time. And the state said, all right, we need to do something new, something maybe a little more positive. We need to recruit more people to call the quit line who are smokers. And so they decided to do this coaching approach. And so I'll play this video that was kind of the new campaign that they launched.
Well, when I was growing up, my father had a cigar shop, and I was exposed to tobacco quite a bit, battling addiction myself and going into the recovery phase. It's not easy. Relapse happens, slips happen. I want people to understand that they can do it. Even if you've quit dozens of times, that first one is not going to be the same as your last one. If you've quit before and are scared, we'll listen. In the end of the day, you can trust us with your quit. You can trust us with your journey.
All right. So which video do you think was more effective in convincing people to call the quit line? Do you think it was the first video or the second video? Raise your hand if you think it was the first one. It's okay, you don't know the answer, you can guess. All right, and raise your hand if you think it was the second one. Okay, so a little background. So the state spent all this money on hiring this marketing company to do this second video. And they had Lute Olson involved in it. I don't know if anyone knows who Lute Olson was, like a famous basketball coach at Arizona. And they launched this whole campaign, did this huge kickoff, and not a lot of people called. It was not super effective. And so they basically scrapped it and went back to the original, to the how much longer will you wait campaign. That one was super, super effective. And so I think, you know, when you think about messaging, when it comes to tobacco cessation, I think that scare tactic has a little more impact than kind of the positive message of having a quit coach for whatever reason. And I'm sure there's a lot of psychology behind that we are not going to think about today or go into. But my point is that, you know, quit lines where I worked, you know, are telephone based, but they integrate a lot of technology, both in the delivery of the actual cessation support, as well as the recruitment piece of getting people to actually call in and use those services. So technology is really important. And when you're thinking about any kind of public health program, both in terms of awareness and convincing people to engage in that program, but also the delivery of that program. Okay. So any questions before we get into the actual course? All right. Okay, so this course has an in-person lecture. We are currently here. There is also asynchronous material. So this class just meets once a week, and then the other meeting is basically online in material that's posted to Canvas for the module for that week that you're going to complete on your own. I figured why not leverage technology in delivering this class and hearing from other people that talk about really interesting things versus me just talking to you for a long time every week. You also have weekly discussion posts. So you have an initial discussion post that's usually that we do on Thursday. And then you have a reply post that is due by Sunday. That gives you enough time to actually reply to a post that your classmate posted. And you also have a quiz that is due every Sunday. So every week you've got a discussion post with 2 posts, and you've got a quiz that is due. That is in lieu of your midterm and having exams in this class. The quiz you will take on Canvas. You are not taking it in class. And you need to finish all of the material for the week before you sit down to take that quiz, because it will cover all of the material for the week. So don't, leave class tonight and not do the asynchronous stuff and try and take the quiz, because it will be very difficult. All right. You also have a final project for the lecture portion of this class where you're actually going to propose the development of a technology-based program, and there are instructions on Canvas for that. All right. So I have adapted this class a little bit since I first started it. When I first started it, we used this textbook primarily for every lecture. Some of the textbook is a little outdated. We're going to talk about technological obsolescence, but technology is changing really, really fast. And textbooks take a long time to come out. So by the time you publish a textbook, there's all kinds of new technology that's out there and all kinds of technology that people are no longer using. So for example, this textbook in one chapter references MySpace. So I have selected specific chapters that are important and relevant for this class, but you might not be using the textbook for every week. For the weeks that you do use the textbook, I have downloaded the PDFs of the chapters for you, so you don't need to buy the textbook. You can also go on through the Cal Poly library in the one search and look up this textbook, and it is available for free, so you don't need to buy the textbook for this class. And there will be other readings on Canvas that will be posted as well. All right, so what do your assessments look like? How is your grade made up? So as I mentioned, you've got discussion posts that are worth 5 points each. You have 10 of them. You've got quizzes to complete every week. Those are worth 20 points each. You have a technology-based program progress report. For your final paper, kind of midway through the class, I have you turn in a progress report. So it kind of helps make sure you're on the right track. Also helps you from procrastinating and waiting till the night before your final paper is due. So by the time you get to the end of the quarter, you've finished almost half of that paper. And I get to provide you some feedback so you can make some changes based on that feedback if necessary. And then you have the actual final paper that is due at the end of the quarter. And then there is the lab component, which I don't think we're gonna talk about too much today, but you do have weekly lab assignments, and there's a final team website where you're gonna essentially take all the things that you did all quarter, put them onto a website along with a few other things, and that will kind of be your final team project for the lab part of the course. So lots of points in this class. All right, for late work, you've got discussion posts that are due each week, and you've got a quiz that's due each week. I don't accept late quizzes or late discussion posts. If you miss your Thursday post, you can still get credit for the Sunday post. So if you miss the Thursday, it's not like you can't get any credit for that discussion. Remember, you have 2 posts you have to make. So if you make the Thursday one, but you forget to make the Sunday one, then you'll get credit for that Thursday one, but you won't get credit for the Sunday one. For other assignments, if they are late, I have kind of a relaxed late policy. They're only penalized at 10% per day late, but please don't do that. If something comes up, if you're sick, if you have an emergency, please let me know and I can work out a plan with you. All right. Masks are optional, right? I'm following the Cal Poly guidelines around wearing masks. If you would like to wear a mask, please feel comfortable wearing a mask. I am not done wearing my mask and I will continue to wear a mask. I would not be surprised if at some point we're all wearing masks again, but I don't want to have any issues with anyone who is wearing a mask feeling judged or criticized by others. So it is up to you, and you are welcome to wear a mask. I don't think that will be an issue in this class, given that most of you are public health majors. Okay. COVID-19 accommodations. Okay, we all think that COVID-19 is like gone right now, right? Like we're all back to normal and everyone is COVID free. People are still getting COVID all the time. If you get COVID, you wake up and you're like, oh gosh, I have a sore throat, I'm coughing. If your roommate is now positive, please don't come to class. Stay home, send me an email as soon as you can. If you've had me last quarter, you know that I will set up a Zoom for you to attend class so you don't get behind. We only meet once a week, so if you miss a class on Monday night, you kind of miss a lot, right? So if something does come up, if you have an emergency, especially a COVID related issue, please let me know. I'm pretty flexible. I'm happy to work with you, but I'm not going to automatically set it up. I will only set up the Zoom if I get an inquiry from a student asking me to do so. I will also say that the virtual accommodation option is meant to be a temporary thing to make sure you don't get behind. So I'm not going to be a happy camper if you just start attending class via Zoom and that's your new way of attending class, unless you have some sort of approval to do so. All right. Questions on the lecture part of the course? And we will plan on talking more about the lab during the lab, but I will put you into groups for the lab. You're going to be doing group work throughout the quarter, but we'll talk about that a bit more in the actual lab piece. Okay. So let's continue on. We've got a brief lecture we're going to go over as kind of an introduction to technology-based health promotion. So before we start talking about technology, I want to back up to the health promotion piece. The World Health Organization defines health promotion as the process of enabling people to increase control over and to improve their health. It covers a wide range of social and environmental interventions that are designed to benefit and protect individual people's health and quality of life by addressing and preventing the root causes of ill health, not just focusing on the treatment and the cure, right? In public health and health promotion, we're really focused on addressing the root causes of health issues that we see, right? And not so much on just that treatment and that cure piece. All right. So we can use technology in health promotion in a lot of different ways. And these next few slides are from the Department of Health and Human Services. And they talk about kind of the different ways that we can use technology in health. The first is to support shared decision-making between patients and their healthcare providers. Provide personalized self-management tools and resources. That's become increasingly popular, especially with smartphone apps. People can kind of self-manage different conditions and track different things. Build social support networks that promote health. Social media has been really important in building these social networks and helping people kind of use these social support networks to improve their health. And deliver accurate, accessible, and actionable health information that is targeted and tailored. We'll talk about kind of targeting and tailoring information a little bit more this quarter. It's also used to facilitate the meaningful use of health IT and the exchange of health information among healthcare and public health professionals. This has been really important during COVID, right? To have public health kind of talking to kind of these clinical settings in managing COVID. Enable quick and informed responses to health risks and public health emergencies. We've also seen this with COVID, right? The data we collect through technology has been really, really helpful in responding to different health issues during times of COVID. Also used to increase health literacy skills and provide new opportunities to connect with culturally diverse and hard to reach populations, which we will talk about a little bit more. Okay, so this slide basically is from a systematic review that looks at how information technology is used in health promotion. And they the authors kind of identified these four kind of overall categories. And the first one is using IT in health promotion as a research focus. So in health information evaluation and actually as kind of the focus of research as a research instrument. So using technology to actually collect data and also reaching research subjects. As I mentioned at the Cancer Center at the University of Arizona, we did a lot of recruitment online in terms of getting people into research projects. It's also used as an intervention medium. So in distributing health information and trying to help people engage in behavior change. And it's also used for professional development. So one of the big ways that we're using technology these days is to increase access to CMEs for healthcare providers, right? And a lot of that professional development piece for public health professionals as well as clinicians. So lots of different ways that we use technology in health promotion. So I want to have a brief discussion. You can break out into groups and the people around you, but I want you to talk about how do you currently use technology for your own health and wellness. And then I want to come back and hear what your groups all talked about.
You would say like your deep sleep and stuff like that. Yeah, it was just like, oh yeah, you got like 12 hours. Like, no, it's like,
All right.
yeah, I don't have to say it.
Let's finish up, but we're gonna start our discussion. All right. What did you just talk about? Yeah.
Using an Apple Watch or the health app on your phone. That's guess or research instrument. To like monitor your health.
Yeah. Did anyone else talk about smartwatches? Yeah. What did you all talk about specifically related to smartwatches? Are you tracking anything specific? Yeah.
Yeah, it has steps.
Ah, steps. Yes, my Garmin like buzzes at me when I haven't moved enough. Yells at me to move. Muriel.
We were looking at the EKG feature that Apple has on mine. We tried to do it on him just now.
Is he okay?
Apparently
It's
no.
a poor recording, so I don't really know. It could be very bad.
I didn't even know that was a feature on there. Is it like a heart? Does it take your heart rate? Like it actually tries to record?
Yeah, it tries to do a real EKG, but it's not amazing yet. Like
Yeah.
it's a starter.
I would imagine that has some limitations. Yeah, Jackson.
For running, there's like an app called Strava.
Yes.
And you can connect your Garmin to that, and then you can like compare like you're running with others, or like join like clubs, so like you can like run together.
Yeah.
Or like train. Yeah. So
Yes.
it's like Instagram for running.
Yes. Yes. I know Strava well. Kind of eerie that you're putting like your running routes on there. People like can see where you're going like by yourself.
Oh, yeah.
Kind of weirds me out a little bit, but yeah, that's another good example. Anyone else talk about smartwatches? Yeah, a year or two ago, I finally bought my husband an Apple Watch, and he is obsessed with his watch. And he's always talking in his watch like this as we're walking around. Oh, so weird. But yeah, all right. What else did your group talk about? Is this one group back here? All right. You guys, oh, you want to share?
Yeah, so we had talked about telehealth opportunities, but also health portals as well.
Yeah, for sure. So has anyone been to the doctor's office somewhat recently? And instead of getting there like a half an hour early, you get to like fill out your forms online before. How nice is that? Wow, it's pretty awesome. That's a great example. Hey, did you have a comment?
Oh, we just talked about how I own my doctor. Now I do everything through my chart app or whatever.
Yeah.
And it's kind of confusing because all health history and everything from my entire life is now uploaded to an app, which is nice, but also I feel just definitely cheap.
Yeah, and you think about the security of that information. Like if someone got that information, that would probably not be a good thing, right? They would know everything about you. Yeah, but that's a great example. Yeah.
I'm kind of off that one. I use Kaiser and there's not one near us. So I'm able to use the app to have doctor's appointments online.
Oh.
And also prescription stuff I had to give one to my sports doctor. And it's easy, I just pull it up and it tells me exactly what it is and everything about it. So
Yeah. Are you able to schedule telehealth appointments online?
yes.
Oh my gosh, it's so
it's
amazing.
nice.
Yeah, it makes it a lot easier to get to the doctor, right? Yeah, for sure. Did someone have a comment? Yes.
I use Follow My Health for Sharp, and I like it because I can text my doctor through the app, so I don't even have to go in.
Oh my
Some of
gosh.
the time I just text them I'm having these symptoms.
They respond?
Yeah, either them or they're nurses.
Oh yeah, yeah, yeah. Someone in the office.
Someone,
Yeah.
but most of the time it's them.
Oh,
And it's a
that's
lot
so
easier than
interesting.
having to go in if I have something that I don't need to get tested for.
Yeah. Yeah, for sure. That's really interesting. I wonder how the billing works for that.
Yeah.
I'm sure you don't get a bill, but I'm sure, as a clinician, they're probably sitting there and just being like, oh gosh, I'm spending all this time responding to people, but can't actually bill for that, right? Yeah.
I've done a Zoom appointment and that's billed just normal time.
Yeah.
Appointment.
Yeah, there's been, I think pre-COVID, there were all these barriers to telehealth and providers being able to bill for telehealth, and then COVID happened, and then everyone had to kind of get over it, and there were a lot of policy changes that happened. And so hopefully continues to stay like that, and we can continue to kind of trend on the lines of that accessibility, right? Because that's really, really important. And even if you have the resources to drive to a doctor's office, people get really busy and you might put things off, right? So it's really important to be able to do that.
Oh, yeah, my cousin actually works for Kaiser and she stresses out about having to respond too because it's factored into her salary. She's she gets stressed out about it.
Oh, wow. Kind of a pay for performance kind of thing that respond to all the messages. Yeah, that
They have 48 hours like that.
wow.
Yeah.
Yeah, and I would assume they have to try and staff that appropriately to have enough people to respond.
Yeah.
Yeah, that's a challenging one. Interesting though. Thanks for sharing. What about in the center? Oh, I guess not the center, this large section over here. What did you all talk about? Anything else? Yeah.
I feel the Peloton, they have a nice little virtual biking things that can help.
Yeah, there's all kinds of apps out there, right? For exercise, and you've got access to all these, sometimes they're paid subscriptions, but there's a lot of free exercise videos out there, which is really awesome. And I'm sure a lot of people have taken advantage of over COVID. Yeah.
I was gonna say Noom or food tracking, weight loss apps.
Yeah, MyFitnessPal, that's a big one. Yeah, and you're just obsessively tracking everything you eat all day. Like a crazy person, but yeah. Any other comments? I saw another hand up over here.
You said the same thing.
Oh.
Food tracking.
Yeah. I think that can be a little challenging. You can get really obsessive about it, right? And it can take up a lot of your time, but it's also super effective in helping people lose weight. So it's a really great thing that you can have access to that just on your phone, kind of everywhere you go. Any other comments about how, yeah.
I think Instagram, like although it might not be the most reliable, it's like a base. I can show you like different yoga poses for like better sleep or like different tips of like how to eat better. And then sometimes I use that, I'm like, is that true? You know, on Google, like, is this the best?
Yeah, we're gonna talk about misinformation and a lot of that stuff kind of at the end of the quarter. It's one of my favorite topics to talk about because it's just everywhere, right? And we see things online, we're like, I guess that could be true, right? Or you see kind of a catchy headline and then you kind of, run with it and you share it. But yeah, the credibility of the information can be a little challenging, but it's still, a great place to go for inspiration for, recipes and things like that. So that's a great one. Any other comments? All right. Well, thanks for the discussion. Okay, so we're going to talk a little bit about some of the benefits to technology based health promotion. So how many of you have searched for medical information online? Yes. When something is wrong, you've got a little red mark on your arm, your back hurts, and you go on and you search, and then you end up on WebMD, and then you're dying, right? You're not going to make it to class next week because you're dying. Yeah. So, yes, you have cancer. Yeah. It's stage 4 too. Yeah, for sure. Yeah. So, okay. So one of the biggest benefits of technology is reach, right? We can reach all of these new people. And in terms of who is using the internet, most people in the US are using the internet. And this data, I think, is from 2013. So I would expect this number to be even higher than 81%, but most people are using the internet. And 72% of them looked for health information online. Women, younger people, white adults, high-income earners, and educated people were more likely to search for a medical diagnosis online. So those are kind of the groups that have kind of the higher rates of looking for health information online. Okay. So what exactly are they looking for? This slide shows the percent of adult internet users who have looked online in the last 12 months for information about, and the largest percent, 55%, looked for a specific disease or medical problem. The next most common thing was certain medical treatments or procedures. The next one was how to lose weight or how to control your weight, not surprising. The next one down makes me laugh a little bit, but health insurance, right? It's so darn confusing. And so of course we have to go online to try and figure out how to use our health insurance if we have it, or how to sign up for it if we don't have it. But these are kind of the common things that people are looking for in terms of information they're searching for online related to their health. So in terms of that benefit, individuals can now seek health information at home on their own time, right? So when you think about it, historically, health promotion was reserved for these more traditional settings, right? Community clinics, hospitals, educational settings, social service settings, and you had to physically go to a healthcare provider or one of these settings to receive face-to-face services. And with limited resources, there's limited capacity in seeing people, right? But technology has really changed a lot of this. And in terms of that reach, we can now reach people who don't have access to those traditional settings. So when you think about who doesn't have access to some of these more traditional settings, one of the populations that we think about is rural populations who might live hours and hours away from the nearest health center, the nearest hospital. And so they might be able to get on to a telehealth appointment with a provider and get at least some services through that mode. But what other groups do you think we are now reaching in terms of this technology who maybe don't have access to traditional settings? What other groups? Yeah. Yeah, so people who might not be in the country legally, who might be afraid to go somewhere in person, right? Especially like a government-sponsored healthcare facility, that might be really stressful. But there might be a way to preserve some of that anonymity and maybe go on to a telehealth consult. What else? That's a great example. Who else are we now reaching that maybe doesn't have access to traditional settings? What kinds of factors kind of come into play? Yeah.
Maybe like an older population that like don't drive anymore or don't have like access to it.
Yeah, for sure. So transportation is a huge one, right? So people who might not have a car, there's a lot of people in this country that don't have a car, right? So if you don't have a car, it's going to be really difficult to get to doctor's appointments and to actually get to some of these more traditional settings. What else? Are you okay? Yes. Oh. Yeah. Yeah, for sure. People who are really, really busy. And kind of on that note, does anyone have a job in here? Do you get paid time off from your job? Some of you might not, right? So there's a lot of people who work a lot of hours who don't get paid time off in this country, right? And so it might be parents who are juggling multiple jobs, people who have kids, right? There's all these different groups that, you know, might not have access to some of these traditional settings that we can now reach. And so when you think about this, really, there's a lot of new opportunity with technology. Okay. So ideally, we want health promotion programs that are both efficacious and effective, right? That's how we're going to have the biggest impact. And when we're talking about efficacy, what we mean is, does it work under ideal and controlled circumstances? And when we're talking about effectiveness, what we're referring to is, does it actually work in the real world under real world conditions? Does it work for a large and diverse number of people? And so if a program has a high degree of efficacy, but it only works for a small number of people, it's going to have a lower impact, right? So ideally, we want programs that are effective and they reach a large number of people to have the biggest impacts. Another benefit is the standardization of the information that you're delivering to people, right? So in traditional settings, you might have to rely on individual people delivering health information, right? And sometimes those people can deliver that in different ways. You might have some people that are maybe more seasoned, that are better at their job and better at delivering that health information versus someone who might be newer, who maybe doesn't have that expertise or isn't providing the same level of health information. And so with technology, we can standardize information and we can deliver content the same way each time. And we're removing this reliance on individuals and ensuring that everyone receives the same thing. And this can be really important, not just for equity of public health interventions, but also ensuring that research-based programs are delivering interventions the same way each time to each person. There are all kinds of standardized text messaging programs and app-based interventions that are really effective at this standardized information approach. We can also tailor information. And when we tailor information, and you're not just sending the same message out there to every single person, when you actually tailor that information, it's more likely to be read, comprehended, and remembered, producing behavior change, which at the end of the day, that's what we're trying to do, right? So we can actually tailor information that we're delivering to different people, which can be really effective. Computer software and systems can create tailored messages. This increases self-relevance, right? So the self-relevance meaning that that information is actually relevant to that individual person, making it more likely, as I mentioned, for them to read that information, comprehend, and remember that information. Libraries of branching content allow for multiple situations and circumstances. And so you can actually use that branching logic and deliver tailored information to individuals who are using different programs. We see this a lot in smoking cessation, diet and nutrition, cancer screening programs. The CDC has a tailored text messaging, several tailored text messaging programs that use a lot of different kinds of branching logic to help people quit smoking. And so if you enroll in one of those, you're going to get kind of a tailored message depending on a number of factors and the information you provide to that system. Interactivity is also a really big benefit when it comes to technology. Social media has been a really, really big part of this interactivity. It increases user attention and engagement, and it helps people connect with others, right? So we've got all kinds of blogs. People can engage in chatting. There's threaded discussion groups, all kinds of texting, and that interactivity can be really important in public health. Another benefit is privacy. And so it can be difficult sometimes getting really sensitive information from people in kind of a face-to-face setting, right? People might feel judged, they might feel concerned about sharing something with someone. It can be, not always, but it can be easier to share sensitive information with a computer versus a person, right? So this can be helpful in certain health promotion areas, including mental health, sexuality and sexual health, eating disorders, and substance abuse. So some benefits around here as well, but there are some challenges kind of around the security of that data, which we will talk about this quarter. Some other benefits: autonomy. You have more control over the sources of information that you read, right? And that you absorb. Portability. We've got small portable devices that can kind of go everywhere with us now, right? So cell phones, they can be used to deliver health promotion programs. How many of you always have your cell phone with you? Yeah, right? So that's another huge benefit. And there's a cost component that we should think about too in terms of that benefit. And when you're looking at the program costs divided by the number of people, so the cost per person, that number goes down as you increase the number of people who you engage in that program. So there's also a cost benefit here as well. There's also some challenges to technology-based health promotion. So one of the big issues is that it can be easy to accrue large samples of people online, but it isn't easy to systematically select them. So you might be trying to recruit a very specific portion of the population, but it's really difficult to systematically select those individuals into your program, into your research study, and you can get kind of these biased samples that may not represent your target population that you're trying to engage in your technology-based program. There is also issues around small participation rates that can make it difficult to generalize findings to the larger population using the internet. So specifically when we think about things like banner advertisements, those online advertisements that kind of pop up on your windows when you're on different sites, a lot of people might see them, but the actual click-through rate of people who actually click on those and actually enroll in a program, those rates tend to be pretty small. And so there's some challenges around that approach. And that can kind of inhibit your validity of the people you're recruiting. Some other challenges include the identification of users and confidentiality. So you may not know if you reached the right person when you're trying to recruit people online for a study or for a program, right? You don't really know who you've gotten, technically. You're not meeting this person, right? Someone is just enrolling online. People might lie about their eligibility for the program. They might enroll multiple times, especially if you're providing incentives, right? Which a lot of research studies do. They say, take this online survey and we'll give you a $20 gift card to Amazon, right? Well, you might want more than one $20 gift card to Amazon, and you might use multiple emails and take that survey over and over again. And now you just gave that researcher bad data, but the researcher has no idea, right? Because you just use multiple emails. But people can enroll multiple times. And you can also get situations where friends and family might respond. You might call a number, and maybe a family is sharing a cell phone, and you might get someone else who isn't that intended person that you're trying to reach. You might get inaccurate data too, especially if you've got incentives involved. People sometimes like to go through those surveys real fast and collect that data just to get the incentive at the end, but people can kind of falsify that data. And people can misunderstand questions too, right? Sometimes, researchers or people who have designed interventions think that their questions are the greatest thing since sliced bread, and then people go to take them and they're like, what are they asking? Like, that's really confusing, right? So there can be some issues around misunderstanding the questions as well. All right, another challenge is attention span. How easy is it to focus on one thing when you're on your cell phone or you're on your computer trying to do homework? Is it hard? Yeah, people get really distracted with technology, right? And you're on your computer and you're doing something, and then your phone goes off and you go to check your message on your phone, and then you check your Instagram, and then you're just like squirrel like over and over again, right? And so your attention span can be very, very limited when it comes to technology. And when we're talking about technology and health promotion, you have to understand that people who are using technology, they expect very brief interactions with whatever it is that you're doing, right? Whether it's taking a survey, whether it's engaging in some sort of online program. And we don't often think about these things in public health research and sometimes in interventions. And so we want to think about if we're doing any kind of data collection online, surveys can get really, really long, right? You want to get the most information from people that you can, whether it's collecting data for research, or maybe someone is signing up for some sort of online intervention. You want to get as much information from that person as you possibly can, but the longer your survey is, the more likely it is that you're going to lose that person. They're going to get distracted and they're not going to complete your survey, right? So that's another challenge. Another really big issue is bias and the digital divide. So technology is not available to everyone, right? It tends to be available for those that are of higher socioeconomic status. There can be issues with accessing technology, especially reliable internet in rural areas. I was at a conference the other week, and someone from a tribe in Arizona was talking about the percent of people in that tribe who own a laptop, and it was shockingly low. I'm going to try and see if I can find the data for one of our lectures, because it was really, really shocking at how low that ownership rate of a laptop was. And so we kind of take for granted that we all have technology because we're all on a college campus, and technology seems to be kind of freely available, not freely available, but seems to be available to all of us, right? But there's a lot of populations out there who don't have access to the same kinds of technologies that we kind of take for granted. Another issue is health literacy, right? Information can get posted in different forms of technology that can be really difficult for certain populations to understand. And so oftentimes you want to think about writing things at a specific reading level. So I worked for a Medicaid health plan, and anytime I wrote something that was going out to the public, it had to be written at, I think it was a 6th grade reading level. So you could not use big words, couldn't use words that people who were in the 6th grade or below couldn't understand, right? But a lot of information is not written that way online, and it can get really confusing and difficult for people to understand. And there is kind of overall a lag in technology use among poor, underserved groups. And in general, the elderly, although the elderly do use a lot of technologies, but there are some individuals in some of those populations that don't necessarily have the same access. All right. Technical obsolescence is another huge issue with technology. As I mentioned with that textbook got developed and then no one was using MySpace anymore, right? So things are always changing, and it can take years to develop really effective and tailored health intervention programs, but it can make it really difficult to evaluate those programs when that technology is kind of constantly changing. And so this is a huge issue as well. All right. So in summary, health promotion focuses on prevention, not just treatments and cures, right? We're really focused on preventing disease and addressing kind of the root causes of illness and bad health. Technology-based health promotion programs are used in a lot of different ways. We talked about some of the different ways that they're used in our lecture. And technology-based health promotion programs have unique strengths and challenges. One of the biggest strengths is reach. We're reaching new populations we couldn't reach before, but as we talked about, there are some challenges associated with that as well. All right. A reminder for this week, you've got your discussion post due and you have your quiz that's due. Your initial discussion post is due on Thursday, your reply is due by Sunday, and your quiz is due by Sunday. There is a lab release of liability form that you all have to fill out that should be posted on Canvas. If you don't fill it out, I'm gonna have to come find you. So please fill it out and make both of our lives easier. As of right now, I'm planning on using one Canvas page for the lecture in the lab. And I don't know if that's a bad idea since there's 2 lab sections. We're gonna go with it. And if things get really crazy, I'll let you all know that I'm gonna move it to separate lab pages. But as of right now, it's on the same thing. So I don't think I opened up your lab yet, but I'll get that opened as soon as possible. All right. Hi.